The recovery from COVID can vary from person to person, but in some cases, the symptoms can last for over 4 weeks, and in those cases, it's termed ongoing symptomatic COVID. Now, in those that haven't made a full recovery after 12 weeks, it's termed post-COVID syndrome, also known as long COVID. The symptoms are widespread, but most commonly include a loss of sense of smell, shortness of breath, chest pain, brain fog. Some of the symptoms can be as diverse as digestive issues like diarrhea, tinnitus, menstrual changes, rashes, joint pains, palpitations. Research suggests that anywhere between 3 and 12% of people who catch COVID can go on to develop long COVID. But we don't know why some people go on to suffer with it when others recover fully. There does not seem to be any correlation with the severity of your initial COVID illness and whether you've been hospitalized or not. We also are unsure whether being vaccinated has any implication on whether you develop these long COVID symptoms. We can't say how long the long COVID symptoms will last for, but evidence does suggest that the symptoms do improve over time in most cases. While some people are able to continue their normal days, other people are significantly mentally and physically affected. And it's important not to compare yourself to others because we know that these symptoms just do not affect everyone in the same way. What I would say is that it is important to just look after your health in general during this time. It can include prioritizing sleep, ensuring you're having a healthy, balanced diet, listening to your body and finding that correct balance between physical activity and resting. Support from friends and family or even online support groups is also important in your path to recovery. And there are a number of charities out there that can help support you too. For example, COVID Aid runs an online course called How to Manage Fatigue Post-COVID. If you are struggling, I would recommend that you do consult with a healthcare professional. And ahead of this appointment, it's really useful if you can keep a symptom diary so that we have a better idea of the pattern and the symptoms of your illness. You're likely to have a physical examination, have some blood tests, and depending on your symptoms, may go on to have further investigations, for example, a chest x-ray. And following on from that assessment, your healthcare professional would discuss with you the type of support you need. And that might involve a referral to secondary care to a post-COVID syndrome clinic. And in these clinics, we have the help of the multidisciplinary team, which can involve a physiotherapist, a dietitian, occupational therapist, and clinical psychologists. And together they will help you reach your goals. In those whom returning to work has been more difficult, it might be necessary to discuss with your employer a phased return to work or alternate duties or simply more flexibility on days where your symptoms are particularly bad. If you're concerned about finances and your inability to work, there is a government-funded service which offers free, expert and impartial work-related health advice called Fit for Work, so you may want to visit that website too. I think on a final note, it's important to remind you that not all of our symptoms are COVID related. So please don't assume they all are. And if you have developed any new symptoms or anything that you are concerned about, please do discuss it with your doctor.